Norse in Wonderland, when nothing's as it seems. Norse in Wonderland, the truth will haunt your dreams. Norse in Wonderland, when nothing's as it seems. Norse in Wonderland, the truth will haunt your dreams.
Imagine trusting your doctor to heal you, only to learn decades later that you were never treated, you were an experiment. Your suffering was their data. Hey everyone, welcome back to Norse in Wonderland, where we chase the rabbit down the darkest tunnels of truth. Today, we're diving into one of the darkest medical abuses in American history. The Tuskegee Syphilis Experiments, where black men were left to suffer and die untreated just to study the disease's progression. No pun intended. They even gave it the most bureaucratic title imaginable, the Tuskegee Study of Untreated Syphilis in the Negro Male, which is government speak for make the title so long that nobody actually reads what it's about. The men were told they had bad blood, which is wild because I've had bad blood with people before, but usually that just means we argued on Facebook, not that the government secretly handed me a death sentence. And the kicker? They promised free meals and burial insurance. Nothing says we care about your health like handing you a coupon for lunch and then a discount at the graveyard. When I first learned the full details of Tuskegee, it broke something in me because it proved that even in the name of science, human life was just another disposable variable. Much like war. Or anything for profit. The Tuskegee experiment was launched in 1932 by the U.S. Public Health Service in Tuskegee, Alabama. It involved 600 black men, 399 with syphilis, and 201 without. They were promised free medical care, meals, and burial insurance, but the reality was sinister. They were never told that they had syphilis. Instead, they were told they had bad blood, a vague local term covering several illnesses. This wasn't treatment, it was deception. The study's goals were to observe the natural progression of untreated syphilis, to determine if there were racial variations in disease impact. Key unethical practices included withholding treatment even after penicillin became the standard cure in 1947, preventing subjects from accessing treatment elsewhere by warning local doctors not to treat them, using community trust against them to keep them in the dark. Imagine knowing there was a cure but being deliberately denied it, all while believing you were being helped. This wasn't a short study. It continued for 40 years, from 1932 to 1972. During that time, many men died of syphilis or related complications. Dozens of wives were infected. Children were born with congenital syphilis. Key quote from survivor Herman Shaw at the 1997 White House apology ceremony: "We were guinea pigs. We were lied to. We were denied." In 1972, Peter Buxton, a whistleblower working for the Public Health Service, leaked the story to the press. Public outcry was immediate and intense. The study ended that year. Of course it did. They wouldn't have stopped if they hadn't been caught. In 1973, a class action lawsuit was filed. Victims and families were awarded a $10 million settlement. In 1997, President Bill Clinton issued a formal apology acknowledging the profound breach of trust and the generational trauma it caused. Wow, I'm sure that was sincere. The Tuskegee experiments led to the creation of institutional review boards to oversee human research ethics. But the damage was done. It sparked a deep, justified distrust of medical institutions among African American communities, a distrust that still exists today, as it should, in everyone. How can a system built on abuse ever expect trust in its treatments and policies today? This wasn't an isolated incident. Globally, unethical testing on marginalized groups continues. Debates over medical experimentation, informed consent, and racial disparities in healthcare remain unresolved. The COVID-19 pandemic reawakened public awareness of historical abuses, shaping community skepticism, because trust, once broken, is hard to repair. How does a history of medical abuse shape trust in healthcare today? Who decides whose lives are worth experimenting on? Has the world truly learned from Tuskegee, or are ethics still traded for data? I honor the lives harmed by injustice. I choose truth, justice, and compassion in every action I take. Also, I'm not bored by this episode. It's like mid-afternoon, so I'm crashing. Thank you for joining me to remember the victims of the Tuskegee experiments. If this episode opened your eyes, share it with someone who needs to know the dark truths behind medical history. Follow Norse and Wonderland for more deep dives into hidden abuses and conspiracies shaping our world. Until next time, stay free, stay compassionate, and stay aware. As always, if anything happens to me, it's more than a convenient accident. I didn't do it myself. I'm happy, healthy, and cautious.
Chasing the rabbit, down we must go. Where does it end? Nobody knows. Hurry up now, we're running out of time. You better keep up or get left behind. Norse and Wonderland.